Thank you, Presiding Officer. And I am pleased to close tonight for Scottish Labour, and I thank members across the chamber for their contributions. I want to start by saying that I do think that, on the whole, across the Parliament, we do believe that this is a considered scientific paper and that message should go out from the Parliament. And I also want us all to reflect that if you get the opportunity to watch the hour from Dr Hilary Cass yesterday, this report has been pulled together by a clinician with an extremely caring side, and that shows throughout the whole hour. There can be no doubt that this is a subject that a lot of people feel very strongly about. It's also an issue that I think has become needlessly complex, when in reality what we want is the best and the right care available for all of those who need it. It wouldn't do to pretend that only the people concerned about this are people you deem out of touch. This is actually a big issue for a lot of people. They are discussing this issue and contact their MSPs, so we do have a responsibility to take leadership in this area. There are legitimate concerns that must be addressed in how the Government responds to the Cass report. Fortunately, Dr Cass has provided some clarity for us, and we need to heed that clarity. I want to make a short mention of our colleague Claire Baker, who as early as 2022 was asking the Parliament to look at the interim report and to show some support for the clinicians who we know were left feeling vulnerable. And that is why this Parliament, this Government, should be involved in the decisions around the Cass review. The findings of the Cass review should be implemented without delay. There are many children and young people with gender dysphoria that need some certainty, and we are in a position to provide them with it. Pausing the use of puberty blockers was the right first step in providing that certainty. My party do welcome that decision, but now we need to move forward and ensure we have quick and responsive services available to these young people, as was discussed by many members, but in particular Polly McNeill and Ruth Maguire. Can I also say that I want to just also add my thanks to people who have shared their stories so that we can get that right for future generations. Unfortunately, we recently had a government tripping over themselves on messaging and substance, and that trend, I think, did cause confusion. The confusion has affected people's lives, and it is not acceptable. And as my colleague Jackie Bailey indicated, we need some leadership, and we hope that we will get that now. I recognise there is now a new leadership in the SNP, and with that comes the opportunity to accept that there were mistakes and that we should look at more sensible approaches, and it is our position that we will make every effort to do that with the Government, as you will see from the amendment, and we do thank the Government for supporting that. We do not need another working group, I think, though, would be our message. The work has been done, Dr Cass and her team widely respected, and there is no doubt that the evidence is good evidence in this report. Dr Cass confirmed to us that she has been discussing her work with the Minister since 2022, so there is nothing unexpected in that report. So this Government knew what was coming, and the session yesterday at the Health Committee confirmed that we could be moving on. The longer we delay, the more young people experiencing seemingly endless waits, and no one wants that. I'm going to finish my remarks there because I know we're tight for time, and I thank all the members again for contributing to the debate.
Thank you. And I call on Marie Todd, up to 5